Hello everyone, welcome to Physiotherapy in Lesotho, www.physioinlesotho.ch. You are listening to a podcast from one of our physio workshop in Lesotho. Your speaker is Thuso, W. Fasser, a qualified physiotherapist.
Assessment of the child, this is the topic. So, as I said this morning, we never finish to learn about assessment of children. And with every child, when we assess the child, we learn something. So, address that topic today, assessment of the child. Now, my Angelica was writing you 3 points on that whiteboard. Let's talk a little bit about that. You can see assessing a child, I could say, is made in 3 steps. The first step is all the time taking a history, a detailed history of that child. That means talk to the mother or to the responsible person who brings that child. And taking the history means we are asking and informing ourselves from pregnancy of that child, birth, until today. So even if that child is 6 years old and he has a disability, go back and ask, how was it during pregnancy? Was mother well? Did she live in a situation where she could be healthy? Or probably was she in a situation where she was malnourished? That will have an effect on the child. Or did she had a trauma during pregnancy, maybe a car accident or something violent happened in the household? That will have probably an effect on that child which is not born. We can have physical trauma during pregnancy, but even psychological trauma to the mother during pregnancy can have a disturbing effect of the baby in the belly. So we are asking, how was the situation, how was nutrition, how was probably stress, was the mother sick, so that we understand. Sometimes you see children, they are somehow disabled by birth, and you ask about pregnancy and everything was perfect. So if everything was perfect during pregnancy, there was no disease, nothing, and that baby is disabled, birth was easy. So that means probably there is a hereditary problem. Sometimes you had difficulties during pregnancy, then you can understand why that child maybe is deformed or had some difficulties. So let's ask about pregnancy to understand. Then we will ask about the birth, the delivery process. How was it? Was it a tough, a difficult labor, or was it easy? Had that child maybe the umbilical cord around the neck? Did they had to make a cesarean section in the last moment? That means the child was in difficulty. So let's inform how was that delivery. Very often when there is a tough and a severe problematic delivery with many hours, the child is missing oxygen, and then they have perinatal asphyxia. That means not enough oxygen in the brain, and then get somehow brain damaged. It can be minimal brain damage, it can be even more, so it can result in cerebral palsy. So let's inform how was that birth process. And then we will ask as well, how was it in the early childhood, the early first few weeks, first few months? How did that child develop? When I have a disabled child, or I suspect some disability, I always ask, did that child suck immediately? Did it cry a lot? Was it somehow irritable, that child? Very often a CP child, cerebral palsy child, you will see in the first few weeks that child is crying a lot. Is not sucking well. Is somehow irritable. Somehow irritable. Nothing makes that child to cry. And then later, after a few months, mother will report, the baby was so floppy. It was not reacting as a normal baby. It was floppy. Like a toy. That means it was hypertonic. It will indicate there is some problem on the nervous system. So we are asking about the behavior of the child in very early childhood. So we understand if this problem maybe is connected to the birth, or maybe it is connected to the prenatal time before the child was born, or if it is maybe connected to an accident the child had maybe after 1 year or 2 years. We could hear now with that Aussie we were treating now, she was fine. She was just a normal child. And then she got that problem that she got very tired. She was floppy. She was no longer responding, acting normally. And then she got that fever, and they understood she had a viral meningitis. So that child was perfect. She learned everything before, walking, talking, dancing, everything. And then she lost it due to this sickness. And she was quadriplegic. And now she is gaining again. She is rehabilitating nicely. So by taking the story, we will understand if that problem of the child was there already by birth, or if it developed a little bit later, or if that child was normal and lost then the capacities. And losing the capacities, the functions, the skill due to a sickness, or sometimes you will have children, they were perfectly normal. And then after 2 years, they start to become somehow. And then they change and they become very strange. And then they probably have difficulty with communicating with the others, not relating anymore to the others. And then we know this is an autistic child. It's a deep, profound difficulty in the development of the child called autism. Or it can be that that child walked, everything was fine, but then slowly the knees were not carrying her again, and slowly that child cannot walk anymore. So it's a progressive problem. There are some myodystrophy, neurological disease, which can cause that. Or we can see children, 10, 11 years, everything perfect, running around, even riding the donkey and things like this, but then the leg starts to shiver, making like this tremor, and the arms start to become tremor, and then slowly that child has very difficulty to move. It cannot coordinate anymore properly, and then it cannot walk anymore. It's just sitting. It remains perfectly intelligent, can think and talk normally, but the arms and the legs are shivering and are somehow strange movement. This is a progressive ataxia. This is a coordination problem, neurological problem. We call it Ataxia of Friedreich. Quite seldom, but you can see that with children. If we have a story like this, we know it is progressive. Other stories like that of the child, it's temporary. She was normal, she lost skills, and now we will work hard, that she regains the skills again. So therefore it's important, whenever you have a disabled child, go back in the story taking to prenatal time, that we understand how was that pregnancy, the mother, and birth, early childhood, and the time until now. Try to understand if that disability was there right by birth, or it came later, or if that child was normal and lost the skills. And try to understand, is that problem progressive, all the time worse, or is it somehow the same? Or are we in the process to getting better? Our Aussie is getting better now, we are happy. That other boy I'm telling you now with that progressive ataxia, he will become worse. So we have to understand, is that problem of the child from birth, from early childhood, or did it appear later? And is this problem temporary, or is it progressive? Or are we in the process to getting better? So we understand. When we take the story, of course, the mother will tell us whatever they have done with the baby. They went to Maseru, to Tsepong Hospital to see the pediatric. Maybe they went to Bloemfontein. Maybe they were seen by a specialist, physiotherapist or so on. Just ask what they have done, what the information is about that child. And we look to the Bukana to understand the reason for disability. There are many. So we will understand looking to the Bukana and looking to the story, understanding that story. Therefore, let's take time to take this story, to understand as much as possible. The second step in assessing a child, after having taken the story, we do the physical examination. You remember when I was just sitting next to the child, I already understood by the storytelling from the mother what that child is able. I gave some question to you while we were sitting there. I understood what the child is able to do. But then I checked her physically. I was listening. How's that breathing going? Is she breathing normally? Yes. I touched her the hand to feel the pulsation of the heart. It was nice, but it was okay, just a normal children's heartbeat. That's fine. I touched her, I could feel, she has no fever. I touched the belly to feel, how is the belly? Is it soft or is it hard? She has a lot of air in the belly. No, it was completely perfect. It seems digestion is going quite well, just by touching her. We were asking how is she eating, they told us. So then I moved her arms, moved her leg. I was just touching, how is muscle tone? How is the mobility of the joints? I touched, how is the reaction of that arm? Is she reacting? Can she feel when I touch her? And I understood that the legs are weak and that the perception of the foot is not perfect. It's there, but not perfect. And I understood that the thighs seems to be big, but it's not muscle, it's fat. So then I understood this child is still atrophic in the legs. And the arm, she has more muscles. There are more muscles and less fat. In the leg, she has more fat and less muscles. So she's atrophic in these muscles. And it seems she has a lot of muscles on the thigh. We thought maybe only below the knee she's weak, but she's weak up there too. She has atrophy in quadriceps and so on. By touching her and feeling that she has more fat as muscle tissue there, of course I had to ask, how is that child eating? And we understood that that child eats a high carbohydrate diet. Is not eating a lot of vegetable and she's not eating a lot of protein. That means the body will produce fat but not muscle. Therefore we said we have to talk about nutrition because the child has to build up muscle tissue now. And if she's lacking protein, the body will take the proteins from the muscles. If we are on a low protein diet, the body needs the protein anyway, so it will take it from the muscles. And we will lose muscle tissue. So in a child like this, which has to boost, has to gain muscle tissue, we have to give her even a little bit more proteins. So just by touching, I understood that child eats too much carbohydrate and too less proteins. So you have to change that, it's clear. So by touching. So I got an idea about physical health, general health, she's okay. Then about the joints, the mobility, the flexibility, the muscle tone, and I looked if she has some deformity. So you look at the basic of health, the physical aspect of that child, that you understand how is that body working. And then we go into the third step. You assess the child for her skills. You want to know what is possible. That child, what skills does she have? What can she do? And this can differ very much. So we have to be there with the child. I have to talk to the mother. We have to observe it. We have to play with her so we understand which skills that child has. Have you made some notes about this? Can we clean it off? You have it? Okay. Angelica, can you please clean it off? And now I write down several areas of observation. When I observe the child, I'm observing certain areas of skills. Do you understand what I mean by areas of skills? I mean sensory skills, looking, listening. Now, ich sage das gerade. Manual skills, gross motor skills, psychosocial skills. So let's write down these skills. We are starting by movement skills. I just observe, watch, ask how that child can move. Can she walk? No. Can she crawl? Yes. Is she crawling normally, or is she crawling like a rabbit or like a frog? No, that child was normally crawling normally. Is she using hands and knees by crawling? Yes. Okay. Is she stable by crawling? Yes. All these things I'm looking. So, movement skills. Then I'm looking for postural skills. Can that child sit and hold the trunk? Does she has head-neck control? Or when she is standing, is she able to hold the pelvis and the chest and the head? These are postural skills. If she is lying on the belly, can she lift up the head and hold it? These are postural skills. Do you understand the difference between movement skills and postural skills?
Yes.
Okay. We could see our child, when she's relaxed, she's a little bit weak in trunk posture. In the upright posture while sitting, she's a little bit weak. But as soon that child is active, when she's singing, when she's playing with you, have you seen how she's strong, how she's straight in the back?
Yes.
So she has quite a good posture for the trunk. Not perfect, she gets tired after a while. But when she's lively active, she is with a very good posture there. So this is a sign of hope, she will get it. You have children, even when they are happy and lively, they cannot extend themselves. They are so weak in trunk posture. But so I'm looking for movement skills, how they can move. I'm looking for postural skills. They're mainly for the trunk and the head. And in standing for pelvis, trunk and head. Now I'm looking to manual skills. That means I'm looking, what is that child doing with the hands? Does she use the hands? Our little child there, what would you say? Is she using the hands? Very much, okay? When she was going on the back of the little horse, she was really using him. And do you remember when she said Harriet to the horse, what she did with the hand? She gave a big bang. I could hear. She did it with force. And she did it very precise. She said, Harriet, boom, as Pondati do when they are on the horse. She was imitating them, perfect. So her manual skills are good. Now you look, when she's grasping something, does she grasp like this, or is she using even 2 fingers to grasp? So the different ways of grasping. Then you look, is she working with both hands or only with one? If you see a child, maybe from 1 year or 1.5 year old, using all the time one hand, you can be sure that the other hand is somehow paralyzed. Because babies until 2 years, they are using normally always both hands. After 2 years, they become right-handed or left-handed. If they do it already before, you know there is a problem on the other hand. Now our child, is she right-handed or left-handed? Could you observe that? She's right-handed. Huh? Is that normal at her age? Yes, it's normal. Is she using the left hand? Yes, perfectly. If it is necessary, she has a bi-manual activity, means she's talking both hands. When she was pulling up on my shoulder, she used both hands. When she gave the bang, she used one hand, the right one. Okay? So, manual skills, and you give her toys and you look how she's playing with these toys. With a little baby, it is normal, you give her something and she will bring it to the mouth. We call it oral exploration. For a little baby, it's normal. Maybe with 4 or 5 months, they bring it to the mouth. If you have a disabled child, probably it still will do that, because it's on that development stage of a little baby. If you have a 5-year-old girl like this one, and she brings the toys always to the mouth, is that normal? No. So that you will see, Helen, here in the development of the manual skills, something is not normal. Okay, so manual skills. Remember, whenever a child has problem with speech and voice, play a lot with that child with the hand, because manual activities are stimulating the voice. This is something because in the brain, the center of hands and center of voice is just next to it. These are neighbor centers in the brain. So when we work a lot with the hand, it will help to develop speech. I don't know if you have seen maybe in a film Italian people. Italian people, when they talk always with the hand, they do a lot of this. Gestures. They do a lot of gestures with the hand because it's so connected, hands and voice. So we have the first three areas of observation. It's movement skills, then we have postural skills, then we have manual skills. Now another area of observation, balance skills. Watch how is that child balancing. Can she sit straight or is she always doing a little bit like this? Can that child hold the hand straight like this? Or does it somehow strange movements? Difficult. She's quite good in balancing. When she's moving on that horse, could she balance well or did she have to make big movement to not fall down? She balanced quite good. When she's walking, can she balance? Can she be straight or is she nearly falling to a side or another? In standing on the feet, that child is not good in balance. She's losing balance. Now when the child loses balance, are there some reaction to find balance again? Yes, she has some reaction. There are children, when they lose balance, they just fall down like a tree. There is no balance reaction. So this child, she's balancing her quite well, only in standing she has not a good balance. And when she's out of balance, she shows reaction of balancing. She shows it, yes. This is a sign of hope. So balance skills. Then we have the sensory skills. That means visual skills, looking. The area of looking. Is that child looking around? Yes. Did she make eye-to-eye contact? Yes. Could she hold the eye-to-eye contact? Yes, she can. Can she focus on something with looking? Can she look concentrated to something? Yes. There are some children, they just look and then they're already somewhere else. They are not looking focused, concentrated to something. So it's a problem. There are children, they don't look you into eyes. So if they don't make eye-to-eye contact, if they avoid it, they want to be seen, don't want to be seen, and they don't want to look at you, they don't want to have eye-to-eye contact, that's normally a sign that in their development of psychosocial skills, there is a problem. Probably autism. Autistic children don't want to have relationship. They avoid relationship. They are somewhere living in their own world. So sometimes the problem is that the eyes are not straight. One is looking like this, one is looking like there. Or it's shivering the eye. Neurological problem. They have difficulties to focus. So if the child cannot focus, it's difficult for her to create images. So therefore we look at these skills, eye-to-eye contact, focusing on contact, taking and holding eye-to-eye contact, seeing, of course, and if they can recognize the objects. We have a child, he's a plurihandicapped child from Moreneng. That boy, he can see, but he has difficulty to focus for more than a minute. Then he's always going somewhere. He cannot remain in an eye-to-eye contact for a longer time. That means his visual attention is not long. That means he cannot develop images very well. So he's sometimes acting like a blind child, but he's not blind, but it's the brain who cannot work with these images. So therefore we look at the skills of visual skills. Then listening skills. That's the ear. Our child, does it hear? Yes. Why do you know that that child hears? How did you observe that? You were calling her, she's answering. Somebody calls here, she turns over, she's looking to the person who was calling, okay? Then you were singing and she entered into the song with the proper words, or she was entering in the right moment. There was a song with two voices, two parts, okay? Elizabeth with her was singing the first part and Mother was singing the other part. So she perfectly entered. That means she's listening. She can hear and she understands. And what I can see as well, she can hear, she has a normal speech, isn't it? She talks normally. She's developed a normal speech. That means that child can hear. A child which cannot hear hardly develops a proper speech. You will hear that child cannot hear properly. The speech is somehow affected. So by listening, talking, you learn to talk. And she learned to talk and to sing nicely, and she's sharp. That's fine. So she can listen, and she's orientated to listening. Now, when we are talking about sensory skill, I look as well to the skill of touching tactile skills, just to touch and to feel by touch. That child, is she touching? She touches things? Yes. And can you see by touching that she feels the things in the hand? You see it when she takes an object and she takes that object in a proper way. That means she feels the object. Sometimes children, they don't feel very well in the hand, so they just take an object, but they are not treating that object with sensibility, with a measured force. They're just using like a stone or a glass. It doesn't depend what it is. That means they are not feeling it properly. So tactile skills, we call that. I could feel in her feet, she can feel, but she's not perfect in feeling. Even when she's standing, she lifts up a foot. Even she's in difficulty of balancing, she does something which makes her even more difficult. That means, I think she's not feeling properly the ground. She's not feeling the feet on the floor. So therefore, she's just moving as if these feet are not there. So that shows anyway we have to do a lot of perception work with her on the feet, that she feels nicely the feet. By touching, you can understand. You ask, do you feel me? Or you tickle, and then when she's pulling the foot away, then you know some perception she has. So we have the sensory skills, most important, looking, listening, touching, and then of course smelling, etc., etc. Then we were looking at speech skills. I observe if that child has an adequate development of speech. So a 5-year girl, I expect that that child can talk normally, that she can explain herself in simple phrases, that she understands more or less everything which we tell to a child with 5 years. She's not understanding, maybe if you talk about politics, she won't understand. But just ordinary all-day language, she understands with 5 years. And I can listen if she's articulating, pronouncing properly, if she has a proper grammatic, the way she's talking, and then I understand about speech. I can listen if she's singing, and the way she's singing, and we could hear she's perfect. Maybe even better as normally you will see with a 5-year-old girl. She's really strong. Did you recognize how she's imitating? She must have somebody in the family who is Matuela, because she knows the song, but even the way these people talk, the rhetoric we call it, of Matuele, she knows perfect. I imagine she has a grandmother, and she's a lot together with that grandmother, and she was participating at the Matuela sessions, and so she learned how to do it. So she's imitating it. She imitates so perfectly. If you know Matuela tradition, you recognize it easily with that child. And the child is not learning that by understanding. She will learn by imitating it, isn't it? So that child has a very developed sense of speaking and singing, and she's very good, that child. And that will help her in learn the movements, because learning movements has a lot to do with rhythm. Movements, rhythm. You could see me, Angelica told me, and then we will have a look at the film as well later, when she was dancing. It was incredible the way she was moving. And she was quadriplegic a few months ago, paralyzed until here. Isn't that great? So with the memory of probably the sessions, the Matuela dancing with her grandmother, the body remembered these movements and they came out. That's great. So her sense for speaking and talking, singing is very developed. Her speech is fine. Okay, then we have other skills. Psychosocial skills, we call them. That means relationship. How does that child relate to the people around her? What would you say? Good, normal, huh? Why can I say she's perfectly normal? When we started to be with her, she was a little bit shy. Is that normal for a 5-year girl when she comes to a group of people which she doesn't know? Yes. Absolutely normal, huh? It's no problem. After a while, when she got in contact, she started to interact. Is that normal? Yes. Yes. If she wouldn't interact even after 10 sessions, then would say, Helen, she is really shy. It still could be normal, but probably it could be a sign that she has some problems in relating herself. Anyway, she got less shy. Then she made contact with you. She looked at you, isn't it? First maybe to Elizabeth because she know her. But then she was even playing with me. I'm much more stranger to her because I'm a white person and I'm Mdate. She was among you women, and seeing you, that it was normal, familiar for her. But seeing us white people, maybe she was a little bit more strange. But she even contacted, so this is a good sign. Then she listened to us. That means she's in relationship. When we were talking to her, she was responding. She was listening to us. An autistic child, these children which are not able to relate to the others, you can talk to the child, it won't really answer. It's not responding as if it's not there. But this child, she was answering, she was getting in touch. Then she did another thing. She was proposing. She told us what we are doing now. She told what we want to play. She said to the horse, hurry, we are going now. She was commanding, isn't it? So it was not only that she was reacting of our proposals, she proposed. And then what we can see as well, there was a dialogue. That means Elizabeth and her, they were talking and playing together, and together they developed the play. Elizabeth said, I make the horse, and she was running up and sitting on the horse. And they said, now horse, you are going here, and you're going there. And so they were playing together. This is a joint interaction, a joint activity. They were sharing the joy, the pleasure, the emotions, the activity. It was a joint, it was a shared activity. This is a very developed way of interaction, of relationship. So that child has a very, very good psychosocial skill. I would say for a 5-year-old child, she's even more developed as an average child. She must be a bright child. So that's fine, it will help us. So you can see now we have many skills. For me, these are the main skill area which I observe. There are other skills which we observe, but don't make it complicated. We have movement, we have posture, we have balance, we have the manual skills, and we have looking, listening, touching, and we have psychosocial skills, speech and psychosocial skills, the behavior together in relationship. These are the areas of observation. While playing with the child, while talking to the mother, doing some activity, doing treatments, in a few sessions, 3-4 sessions, you will gain a lot of knowledge about that child. And you will understand in which of these areas are weaknesses and have to be stimulated, improve, and in which of these areas the situation is good. This is my watch was telling that we have tea break. We have perfect on time. So, by looking at this observation, we will find out which of these areas are well developed and which of these areas probably are in difficulty, and we have to make the plan to help this child. Is that understandable? Yes. For now, I just would like that you have written down these areas of observation. That we get aware, these are the points we have to observe when we play and visit the child to understand how we can help the child. Because there is no treatment for cerebral palsy. There is no treatment for this diagnosis. There is only the treatment for a child. And every child is different. We have to see how that child is developed. And then we do the therapy for this child. So this, we call it, it's a development state orientated treatment. So we're treating the child by his development state. So we're looking at development, and then we do what that development state needs. We are not treating the term cerebral palsy. We are treating the child in its development. So by looking at these areas of observation, we understand more or less, it's never perfect, the development, and then we can organize the treatment around that. Now, let's make tea break. At 10:30, we will meet again here, and we go on with this development-orientated interaction in therapy.